What news? Some people want to reduce fat in order to achieve their ideal body. Then, where does the ideal and the fear towards fat come from? Fat is sometimes associated with bad health when we talk about fat in general. Today, I'll consider fat, which is highly victimized, especially after research was published in the US. Restrictions of artificial trans fats are associated with a decrease in cardiovascular disease. A report indicates that some countries restricted the use of artificial trans fatty acid. Hospital admissions for heart attacks have decreased by 6.2% compared to the country without the restriction. This research was done by researchers from Yale University, University of Southern California, Los Angeles, University of Colorado, and University of Chicago. They analyzed the data of the country's restricted trans fats compared with the non-restriction ones. Artificial trans fats were first banned at restaurants in New York in 2006. 10 other countries initiated the restrictions between 2007 and 2011. Also, the U.S. Food and Drug Administration plans a nationwide restriction in 2018. So, do trans fats cause heart attacks? But what exactly are heart attacks and trans fats? First, heart attack usually occurs when a heart doesn't get enough blood supply. One of the examples of many is when a blood vessel that carry blood to the heart is obstructed due to the cholesterol plugs, resulting in the malfunction of the heart. The damage causes the symptoms of heart attack, such as chest pain, shortness of breath, lightheaded, and pale. Trans fats are usually produced industrially from vegetable oils. Those vegetable oils are fluids in room temperature, but by converting them into trans fats, they can stay solid in higher temperatures. Margarine, snacks, and packaged food are some of the products that can contain trans fats. Why do they cause heart attacks? Trans fats are blamed as factor of heart attacks. This is because excessive amount of trans fats narrow the blood vessels by increasing the amount of LDL cholesterol, which accumulate plaques on the wall of them. This makes blood harder to go through, and when it stucks, it causes diseases such as heart attack. Because of the association of trans fat and heart attack, trans fat was restricted in New York, and the restriction is considered to decrease the number of patients with heart attack. How about the situation in Australia? The government has different concerns. In some countries, including Australia, governments are not as eager to restrict trans fats. In Australia, people only consume 1/5 of trans fats compared to an average American in 2004, which is before the restriction started. Australian government claims this is well below the World Health Organization's recommendation. But they still encourage people to limit eating food, such as many biscuits, cakes, processed meats, and other savory snacks. Those foods contain another kind of fat called saturated fat, and this is also a factor for cardiovascular disease when consumed excessively. Add to that, our research indicates that the restriction of trans fat increased the consumption of saturated fat. So, victimizing trans fats may encourage people to choose butter rather than margarine, but natural fats also increase the risk of heart attack if we consume it too much. It was about bad fats, but this doesn't mean all of the fats are bad. They are essential for our body. The research and the government suggest not to eat too much because we are in a situation that allows us to access excessive amount of them.